Good evening, everyone who have joined us this evening for our online awards ceremony for the inaugural Health Economics for Africa essay competition. I am going to briefly just run through the program. What we will have tonight is first Ayanda Saboni, the head and director of the PPS Foundation, will open with a few remarks. We will then have Dr. Nadia Yakelev talk a little bit about health financing in Africa. And after I've introduced her briefly, we will then play a short video that will announce the finalists and prize winners. And before we conclude, we will have each of the 6 prize winners share with us a very short remarks on health economics and its importance. And after that, we will conclude. It gives me great pleasure to firstly introduce Ayanda Saboni. Ayanda Saboni is the head of the PPS Foundation.
Good evening to distinguished guests, colleagues, and members of the academic fraternity, judges, but especially the talented students joining us today. It's my pleasure to welcome you to the Health Economics for Africa essay competition. And I want to just say that today is not just about the essay competition. It's about ideas, it's about leadership, it's about the future of healthcare in our continent. Across Africa, we face some of the most complex health challenges of our time. We're confronted with difficult questions around access to healthcare, affordability, workforce shortages, disease burden, as well as health financing. All of this to make sure that we have a sustainable health systems. These challenges do not exist in isolation. They intersect with economics, some social issues, policy, education, as well as technology. And this is precisely why health economics actually matters. Health economics helps us to understand how limited resources can be used to achieve the greatest health outcomes and helps policymakers make informed choices that enable health systems across the continent. If you think why this is important for our continent particularly, when we went through COVID, that experience taught us that our solutions for our continent need to come from within our continent. This competition provides a voice to both undergraduate and postgraduate students across the continent for them to showcase some of their leading ideas and how they can find solutions to the problems that we have. I look forward to hearing all about the ideas that have come through, and I want to congratulate all the participants, not only the ones that are winners tonight, but also the ones that entered the competition and have given of themselves, their time and their talents to do this. Thank you and congratulations to the winners.
Thank you, Ayanda, for that introduction. Dr. Nadia Yakelev is the head of Africa Centers for Disease Control's Health Economics and Finance program. She represents Africa CDC in various global health fora. Based in Addis Ababa, she is a proponent of a new compact in which Africa will have more agency over health financing and priorities.
Dear Chair, distinguished colleagues, dear students, thank you very much for your kind invitation. It's a real pleasure to be with you today. First of all, let me congratulate all of you. Of course, I congratulate those who will receive awards today, but I also congratulate every student in this room. Before I begin, I must confess something. I wish I were in your shoes. You are entering in the field of health economics at one of the most exciting moments in its history. Indeed, for many years, the central question in health financing were relatively well understood. How do we mobilize more resources? How do we tackle major infectious diseases? How do we expand access to healthcare? Research has transformed understanding of this question. It has improved the allocation of scarce resources, informed public policy, strengthened our ability to assess the effectiveness of health intervention and supported progress toward universal health coverage. And across Africa and around the world, it has fundamentally shaped health policy and the way health systems are financed. Today, however, while these questions remain as important as ever, they are no longer enough. Public financing are under increasing pressure, development assistance is evolving, and across Africa, countries are seeking greater sovereignty of their health systems. And at the same time, pandemic, climate change, and antimicrobial resistance remind us that many of today's health challenges cannot be addressed by countries acting alone. We still don't have all the answers. We know a great deal about how to mobilize more resources for health. We know much less about how to redesign financing system without weakening health systems, how countries can become more self-reliant while protecting the progress they have made. What role external financing should play in this changing environment, and how to finance public goods that no country can provide on its own. When the world changes faster than our knowledge, research must evolve as well. And yesterday's answers will not always be enough to guide tomorrow's decision. For nearly 3 decades, the central challenge was to mobilize more resources for health. And I strongly believe your generation faces a different challenge, which is designing financing models for a changing world. That means asking questions we have never had to ask before, and not being afraid to ask them or to search for the answers. How can external financing strengthen sovereignty rather than constrain it? How should we finance cross-border challenges such as pandemic and climate change? How do we bring together domestic resources, private investments, and financing for regional and global public goods? What financing mechanism will enable us to meet the challenge of the next 20 years rather than those of the last 20? And perhaps more importantly, what innovations can Africa bring to the world instead of simply importing ideas from elsewhere? And this is exactly why this research matters so much to an institution like Africa CDC. Our role is not only to respond to today's health challenges, it is also to help shape the future of health in Africa. Every framework we develop, every recommendation we make, and every policy we support must be based on strong evidence. And that evidence has to come from research that reflects African realities and tackles the questions that still do not have clear answers. That is also why I accepted this invitation without hesitation, because supporting young researchers is not just important for universities, it is equally important for institutions like Africa CDC. The ideas you develop today could become the evidence that guide tomorrow's policies, influences continental strategy, and help build stronger and more resilient health systems across Africa. And this is precisely where your generation has a vital role to play. You have the opportunity to study at a university that encourages excellent research. Use it to develop new ideas, not simply repeat existing ones. Africa does not simply need more research. It needs research that informs public policy, anticipate the changes ahead, and propose new financing models that reflect reality of the continent. These are the questions I hope you will explore. Answering them will require far more than economics alone. It will require public finance, governance, political economy, data science, and that is precisely what makes this field so fascinating. I am sometimes struck by the fact that we will encourage too many wrong researchers to answer questions we have already answered. I would like to encourage you to do exactly the opposite. Look for the question that no one has answered yet. Do not be afraid to challenge the assumption of previous generation if the evidence points in a different direction, because that is how research moves forward. I am convinced that Africa does not simply need more scientific publication. Publication matters, of course, but we also need new ideas and new way of thinking. And Africa needs new approach to health financing, approaches that reflect its reality, strengthen its institution and match its ambition. The continent is changing very, very rapidly. Its research must change with it. And perhaps that is the message I will most like to leave with you today. The future of health financing in Africa will certainly depend on governments, regional institutions, international partners, and so on. But it will also depend on the researchers sitting in this room. Perhaps one of you will change an idea that we now take for granted. And I sincerely hope you do. Congratulations once again to all of the today's award recipients, and indeed for every one of you. I wish you a very success in your career. Thank you very much.
I'm now going to play a short video that presents a brief introduction to the finalists and the winners of the competition. It's a 3 minutes brief overview. Enjoy it. Thank you, and thank you for the applause. So congratulations again to each of you. What we will do now is we will have each of these 6 prize winners just share a very, very brief remark on health economics and its importance in Africa.
I'm Jean-Claude Nyirimanzi. Health economics matters for Africa because every clinical decision made on this continent is also, whether we admit it or not, an economic one. Who gets care, when, and at what cost is never purely a medical question. It is a question of resource allocation, political priority, and structural design. Africa carries the heaviest burden of preventable disease while commanding the smallest share of global health financing, and that gap will not close through goodwill alone. It will close when we learn to speak the language that actually moves governments and system, and that is evidence, efficiency, and the true cost of doing nothing.
My name is Tosin Michael Towolawi, and health economics matter for Africa because resources are limited and needs are vast. It helps us decide which health programs save the most lives per naira or dollar spent. Without it, we risk funding what is popular instead of what is effective. It makes universal health coverage realistic, not just aspirational. It puts evidence at the center of every budget choice.
I am Francis Kambausi, and health economics matters for Africa because our greatest challenge is not just the scarcity of resources, but how we choose to use them. Every funding decision, every policy, every investment determines who receives care, who is left behind, and ultimately whether our health system survive or truly become sustainable. Health economics helps us ensure that limited resources creates the greatest possible impact for the people who need them the most.
I'm Wayne Andrade, and I think health economics matters for Africa because the continent faces various health challenges, which is very unique. So we can't apply solutions which have been done in first world countries because our challenges are not only healthcare financing, but also, I would say, health-related behaviors and outcomes or diseases. Stronger health systems is important, but also understanding why the issues persist in our context, the causes, the determinants of these issues will help us resolve these problems.
I am Yuvir Naidu, and health economics matters for Africa because our continent's future depends on how wisely and fairly we invest in people. Every health decision is also an economic decision, shaping families, workers, communities, and national development. Africa needs health systems that do not respond to illness. They must protect dignity, they must prevent hardship, and they must strengthen human potential. Health economics gives us the tools to make those choices with evidence, fairness, as well as accountability.
I am Tatohati Sifuti, and health economics matters for Africa because our healthcare needs will always exceed the available resources, and health economics serves as a gateway to ensuring that we make evidence-based decisions that ultimately ensure that we are distributing health services equitably to the people that need them the most.
These remarks and the remarks of Nadia are very important. They are important, I think, in the context of this competition. And that's why we called it Health Economics for Africa. And we look forward to having a competition again. We also look forward to working with each of the prize winners to further their work and give them a voice. And we look forward to using the competition as a platform to advance health economics on the continent.